Dr. Sajid here. I'm going to be talking about a very common condition that you are all aware of, and that is poliomyelitis, or simply polio. And you are by now probably experts at it, but let me explain what this disease is and what can we do about it. Firstly, it is caused by a virus. Virus is a kind of a germ, as you have already been told. There are two types of germs, one viruses and the other is bacteria. Of course, there are others, but these are the two main kinds. Viruses are much smaller and commoner, and of course cannot be seen by the naked eye. The virus enters the body through the mouth and sometimes through the throat, mostly by contamination, whether that be food or that be water. So this is what we call enteric form of viruses, that is intestinal generally. The virus then gets into the body, gets into the intestine, and then it multiplies from there in the lymphatic channels, and then it spreads to the rest of the body. So there are two phases initially. There is a condition which may be common to all viruses, that is a bit of fever, a bit of aches and pains, not feeling so well, and then the baby seems to recover, and then a few days later a second form of illness strikes, which may not be recognized as part of the same, in which there is more headache and more body aches, more fever, and the baby now can get into difficulty. If the baby survives this virus, fine, then the baby has immunity. If the child does not, then this can affect the brain and the covering of the brain, and that is where the problem is. In its severest form, it can affect muscles of breathing, and the child may have difficulty even being able to breathe. But the more important part is that it affects the muscles of the legs or of the arms, and the child becomes paralyzed, cannot properly move the legs or the arms, and this results in a form of a paralysis. Now this is very debilitating, and the problem is that although you may treat it with pain relief and some physiotherapy and some occupational therapy, the effect remains, and so many children, and therefore grown-ups later on, they become crippled, and this remains a problem throughout their life. So the disease can be life-threatening, it can be crippling, and it causes a lot of problems for the child and the family. This, however, can be prevented, and the prevention is by obviously being very careful about what you eat and what you drink, and of course keeping your household clean and having proper sanitation. But the most important thing, of course, is that you can vaccinate your child. You can give them what we call vaccination. And you've heard of the polio vaccine. It comes in two forms. One are the oral polio drops, and they are given right at birth and then given at 2, 4, and 6 months. And in our setup, in the expanded program of immunization, they're given at 6, 10, and 14 weeks, which is slightly earlier than 2, 4, and 6 months. And then boosters are given during the second year. Now, the oral polio vaccine is very effective, and you only need 2 drops. So one is given at birth, and then the other 3 within the first 6 months, and then subsequently. The problem is that in countries like ours, the absorption of these drops is not as good, because we have a lot of intestinal infections, diarrhea, and our children are malnourished. So we need to give more and more, and therefore the campaigns. And my plea to you is, if the team comes or when it is announced, please get your children these polio drops. There is another form of vaccine which is injectable, and which the program on immunization in Pakistan is also giving at 14 weeks once, and in the private sector you can get these vaccines about the same time, 2, 4 and 6 months. So the ideal situation is where you get both vaccines, and if not, at least get the oral polio vaccine. So I hope that this answers a number of your questions. The disease can be serious, but if you can prevent it, that is best, because there is no specific treatment, and the solution is by giving immunization, which is very, very simple. The other thing that I must emphasize here is a question that I'm asked often is, how often can you give these drops? As often as there is a campaign. There is no harmful effect either of the vaccine or of giving it repeatedly. This is a safe vaccine, this is an effective vaccine, and it is very important that we ensure that our children don't get it, and actually no children get it, because currently only Afghanistan and Pakistan are the only two countries that have polio left. So understand this, we seek your help, and we hope that you will prevent this from happening in your child and in your family and in the community.